The onboarding and advising course serves as your first course in the program. It's self-paced and not graded, but you do need to finish it before starting your first official courses. This course stays open to you throughout your studies. You can and should come back to it often. During onboarding, we have 3 key objectives for you. 1, become familiar with the Coursera platform. You'll take all of your courses on Coursera, so spend this time learning how to move through the modules, locate resources, take quizzes, and submit assignments. It's a great time to practice in a low-stakes environment. 2, review policies, procedures, and services for students. As a new Michigan Wolverine, you'll need to know about the university and Coursera policies that support our scholarly community, as well as all of the practical day-to-day stuff. Getting started with Google at U of M, navigating Wolverine Access, registering for courses, and making advising appointments. You should also explore the many resources we have in place to support you academically, professionally, and personally. 3, build a preliminary program plan. We want you to understand the general program design so that you can anticipate when you take which courses. During onboarding, you should outline your preliminary program plan. You can make changes as you go, as long as you keep us posted. Your first 2 terms are already laid out for you. Just take the core required courses. No big decisions to make here. After you set that foundation, you'll move on to choosing electives for your 3rd term and beyond. Let's look at the first term of the Pop Health MPH curriculum. Fall term includes 9 credits of core courses. In the first half of the term, you'll take 2 courses, Pub Health 512 and Pub Health 508. In Pub Health 512, Principles of Epidemiology for Public Health, you'll learn how to collect data and how to understand the data you've collected. You'll study the determinants and distribution of disease in human populations by discussing real-life scenarios and working through problem sets with your cohort and instructors. In Pub Health 508, Social Determinants of Health, you'll work towards understanding and reducing health disparities while examining the role of societal factors in population health. By the end, you'll propose a structural intervention to address a public health disparity topic of particular interest to you. In the second half of the term, you'll take Pub Health 511 and Biostat 501. In Pub Health 511, Nutrition and Public Health, you'll learn about hot topics in nutritional sciences and how to harness that knowledge to develop and evaluate nutrition programs and interventions that will improve health outcomes at the population level. So, for your final project, you'll actually propose a program or intervention to address a nutrition problem for a targeted population, community, or cultural setting of your choosing. At the same time, you'll take Biostat 501, Introduction to Biostatistics, which covers the statistical methods and principles necessary for understanding and interpreting data used in public health and policy evaluation and formation. You'll learn to visually and numerically describe characteristics and behaviors of a population, and quantify how strongly those characteristics and behaviors are linked to human health and disease. Then you'll enjoy a hard-earned break before the next term begins while the university is closed for season days leading up to the new year. Let's look at the second term of the Pop Health MPH curriculum. Winter term includes 9 credits of core courses. The first half of your term includes Pub Health 513, Public Health Systems, Policy, and Management, which will help you prepare to interface with administrators, managers, policymakers, and stakeholders. You'll learn the differences between public health and healthcare, the role governments play in public health decisions, who's involved in the financial management in health organizations, and how to advocate for public health policy. At the same time, you'll be taking Pub Health 510, Communication Fundamentals, which is all about developing highly applicable skills to make your communications clear and effective for any audience. You'll learn to think about your audience, identify what you want to achieve, find your core message and shape it to achieve your goals, and then craft the big picture narrative. Then, in the second half of the term, Pub Health 514, Public Health Sciences and the Environment, will explore how different aspects of the environment can harm or benefit our health. Many public health outcomes are influenced by contact with the environment, and you'll learn to apply environmental health and systems thinking principles to evaluate major public health threats, and to assess different policies that are designed to minimize or address these and other threats to public health. You're going to have a lot of fun tagging along with the instructor as he explores environmental and occupational hazards on location. Pub Health 515, Population Health, will serve as an introduction to population health from the vantage point of both public health and healthcare. You'll dive into what makes a population healthy and how to measure a population's health. Throughout the course, you'll engage in a health crisis simulation and design multi-sector collaborations that support the phases of population health improvement. You'll be done with most of your core courses and have taken one introductory course from each subject area. That sets the foundation for you to start choosing electives for the upcoming terms. After your first 2 terms, you need to start making some choices. You'll be able to register for the spring, summer, and fall terms at the same time. Each of the 6 departments at Michigan Public Health offers elective courses in the Pop Health curriculum. The MPH requires a minimum of 19 elective credits. We offer electives in 11 credit bundles, or series, that span over 2 terms. Each series also corresponds to an MPH graduate certificate program. Series 1 courses are offered in spring, summer, and fall. Then Series 2 courses begin in winter and run into the following spring-summer term. We recommend taking all of the courses within a Series 1. You can continue on in the same subject for Series 2 or change subjects. Let's look at Series 1, spring, summer, and fall. The Biostatistics Department offers a series in Analyzing Health Data, which includes courses in R, Regression, Design for Health Studies, Linear Models, and Longitudinal Analysis. Environmental and Occupational Health Sciences addresses exposure science, toxicology, infectious disease and emergency response, and risk assessment. Applied Epidemiology includes methods, social epidemiology, data analysis, and surveillance. Health Behavior and Health Equity addresses community engagement, program planning and implementation, program evaluation, and psychosocial determinants of health. Healthcare Accounting and Finance includes managing healthcare systems, financial accounting, operations research and control systems, managerial accounting, and corporate finance. Maternal and Child Nutrition addresses epigenetics, foundations of maternal and child nutrition, and food security. If you complete all 11 credits in any of these series, you can earn the corresponding MPH graduate certificate. You'll also be taking Pub Health 680 throughout the fall term. This 2-credit course will walk you through the applied practice experience. You'll work with non-academic partners on real-world public health products that demonstrate competencies you've gained so far. The course will help you identify the partners and establish plans for the projects, which can include infographics, visual abstracts, survey instruments, and evaluation reports. The second winter term marks the start of Elective Series 2. These series stand alone from the first. You can change subjects at this time or continue on in the same subject. Public Health and Environmental Sustainability addresses food and products, global themes, water quality, climate justice, and policy. Spatial Epidemiology and Modeling includes GIS, data analysis using R, spatial analysis, and spatial modeling. The Health Behavior and Health Education Methods and Skills series includes behavioral research methods, motivational interviewing, survey research, and clear communication. Managing Health Policy and Practice includes economics, dissemination and implementation science, cost-effectiveness analysis, and data management and visualization. Precision Nutrition includes molecular nutrition, genetic epidemiology, life course epidemiology, and translating science to practice. If you complete all 11 credits in any of these series, you can earn the corresponding MPH graduate certificate. Note, if you complete 2 full series, that puts you at 22 credits, which exceeds the minimum requirement of 19. Many students choose to do so and earn 2 certificates. However, it may be possible to leave out up to 3 credits from a series and still meet the total degree requirement of 42 credits, as long as you pay attention to prerequisites needed for further courses. You'll also be taking Pub Health 681 throughout the winter term. This 2-credit course will walk you through the integrated learning experience. Throughout the course, you'll prepare a final capstone paper on a topic and genre that fits your career goals, such as a grant proposal, policy brief, program plan, or community health needs assessment. The final required course of this curriculum is Pub Health 516, Leadership Skills for Interprofessional Practice. This course is designed to identify characteristics of exemplary leaders, and develop skills for leading interprofessional teams to address public health problems. These leadership skills will equip you to improve the health of populations no matter what job you pursue after graduating from Michigan Public Health. At the end of the program, you will have achieved at least 42 credits. You can review your progress in Wolverine Access by pulling up your official transcript or the unofficial audit checklist at any time. You'll also use Wolverine Access to apply to graduate. The program will do a final official audit before conferring your degree.